In the medical city, the consent form isn't just a matter of signing a form. It involves a detailed, point-by-point discussion to make sure that the patient understands fully what he or she is signing.
You're supposed to explain to the patient what will transpire in the operating room in terms that you would understand. You must also explain the risk inherent to the procedure, not only in terms of anesthesia, but inherent to the procedure itself. You should also know if the patient can speak English or not. You have to know the dialect, especially in the Philippines, the dialect which he speaks. And if you don't know, then, like I said, you have to get an interpreter.
So when we explain the consent form, we explain it to the parents and we then tell them what we are about to do. When we do that, we tell them step by step what is going to happen. We explain if it's general anesthesia or regional anesthesia. But when we do that away from the child's ears, okay? Because when you explain to the child, like I said earlier, you have to explain it in terms he will understand.
After the pre-op visit and the consent form, the next step in the anesthesia process is the surgical procedure itself. This is when all the information gathered and shared between the doctor and the patient is put to use. A successful pre-op visit ensures that the anesthesiologist enters the operating room well prepared and very familiar with the patient's needs and requirements. At the same time, the patient will be more relaxed during the operation because the procedure has already been explained thoroughly, and he or she already has rapport with the anesthesiologist. Before being wheeled into the operating room, a patient may be given medication to help him or her relax. Once the medication has taken effect, the patient is brought to the operating room where his or her anesthesiologist is already waiting.
First, you check chart and patient, because you have to be sure that the patient who's going to undergo this operation is the patient that you have on the floor with you in the OR room.
The procedures for the application of anesthesia vary based on the kind of anesthesia to be administered.
Peripheral nerve blockade is the injection of local anesthetics into the nerves that innervate the upper and lower extremities. We will do a femoral nerve block, which is easy to perform. It has a low risk of complications, but with a very high success rate. Peripheral nerve blockade requires proper setup, careful preparation, detailed planning, and continuous monitoring to provide safe and effective patient care. Once all monitors are attached to the patient, a peripheral line is inserted. With the ultrasound, we visualize the surrounding structures, such as a femoral artery. Now we see the needle approaching the femoral nerve. Once we see the tip on the nerve, we can confirm by using the nerve stimulator. If the current is decreased to 0.2 to 0.5 milliamperes and still the twitches are elicited, then the position of the needle is judged adequate. After negative aspiration for blood, 20 ml of local anesthetic is injected. Here we are using 0.25% bupivacaine because we are after sensory block only. Since this patient is for outpatient surgery, she will be going home in a while.
Ang ibibigay po nating anesthesia dito ay tinatawag na spinal anesthesia. Ang unang gagawin po natin, itatagilid muna natin yung pasyente and then i-prepare po natin siya ng antiseptic sa likod, yung i-inject na natin ng karayom. And then after that, tsaka tayo mag-i-inject ng anesthetic. Ito po ay gumagamit tayo ng napakapinong klaseng karayom na yun ang i-inject natin sa likod niya para siya mabigyan ng anesthesia. Pagkatapos po maibigay natin yung anesthesia, ang karaniwan pong mararamdaman ng pasyente ay yung lower side ng katawan niya, wala na po siyang mararamdaman. So, pwede na pong operahin siya anytime. Ang epidural anesthesia naman ay isang form ng anesthesia na halos pareho lang ng spinal anesthesia. Itatagilid din yung pasyente, ipe-prepare siya with antiseptic, yung likod niya, and then ilalagay na po yung epidural anesthesia. Ngayon, ang ginagamit po nating karayom dito medyo mas malaki. Kasi may isusuot pa po na tinatawag na epidural catheter. Ngayon, doon sa epidural catheter na yon, doon ilalagay yung ating anesthetic drug. Ang epekto po noon, halos pareho lang ng spinal anesthesia. Ang kaibahan lang po ng epidural sa spinal, medyo matagal-tagal ng konti ang onset ng anesthesia natin. Hindi kagaya ng spinal anesthesia, agad-agad mararamdaman ng pamamanhid.
Okay, so what I'm going to show you this morning is general anesthesia, or GA for short. What we want to achieve during GA is analgesia, which is absence of pain, amnesia, lack of recall, and muscle relaxation, and of course unconsciousness. So we have lots of agents to be used for general anesthesia, and it can be either gas or volatile liquids, and drugs delivered through the IV. So first we give an opioid, followed by a rapidly acting hypnotic agent, which we use to inject to produce the narcosis or deep sleep. After that, we secure the airway by putting a tube or a mask wherein we deliver the anesthetic gases. So after that, we maintain the anesthesia until the procedure is over, and then we put all anesthetics off and wake up the patient.
In the medical city, actually, it is an honor and a privilege for us to care for children. But we must remember that children, they are not miniature adults. So when we give them anesthesia, there are a lot of things that are different when we give it to them. So we have to just reassure them that they will be asleep during and after surgery, but when they get to the recovery room, they will be awake, and their mom or their dad will be with them.
Many people think that the role of the anesthesiologist is limited to the application of anesthesia. But the truth is, the anesthesiologist is responsible for more than just that.
After induction of anesthesia, the patient is continuously being monitored. After the surgical plane of anesthesia is started, the procedure will commence, after which the patient is maintained on anesthesia for the whole procedure. The vital signs are being monitored every 3 to 5 minutes. The heart rate is being monitored continuously, and the pulse oximeter, which is an instrument that measures the oxygen saturation of the patient, is also continuously being monitored all throughout the procedure.
As anesthesiologists, we're supposed to be calm during any emergency. That's why many of us suffer from high blood pressure and arrhythmias, because we're the ones who takes care of patient's life. Because the surgeon just cuts and sews and takes out the organs. And if it's a transplant, puts it in. But it's us, it's the anesthesiologist who controls the blood pressure. If there's a lot of blood in the field or a lot of blood loss, it's the anesthesiologist who replaces the blood. So the one who takes care of the vital signs and keeps the patient alive is the anesthesiologist. So you should be aware of who your anesthesiologist is, because it's the anesthesiologist who really holds your life in his hands.
All throughout the procedure, the anesthesiologist monitors a patient's vital signs and makes sure that the patient is stable. And in rare instances, when something does go wrong during the operation, it is the anesthesiologist who has to stay on top of things.
Okay. All the anesthesiologists of Medical City are trained and certified to do advanced cardiac life support, that's ACLS. Okay. Also, when we're giving anesthesia, we have a crash cart available. It contains all the emergency medicines and all the emergency equipment we might need. Okay. So we are trained to have a plan B, so that we are not caught flat-footed. In any eventuality, we could always go to another plan or ask for help from other anesthesiologists here.
Credentialing and privileging in the Medical City and the Department of Anesthesiology in particular follow a very stringent process to the end that each of the members of the department can administer anesthesia under similar conditions and standards.
At the end of the procedure, it is the job of the anesthesiologist to wake the patient or to take him off the anesthesia, a process called emergence from anesthesia. This we will tackle when we return.